Now, you just returned from Sudan, where you saw firsthand the crisis that is unfolding. Can you give us an overview of the current situation?
Well, most of the territory of Sudan has been hit by this recent war that started in April last year. Out of 45 million inhabitants, 7 million have been displaced, some of them going to neighboring countries, most of them staying into Sudan, and part of them being displaced several times from one place to another, fleeing the fighting. Now, the situation is, of course, very difficult for that population. It's a major economic crisis that is also happening. It's very difficult to make a living in Sudan. People rely on money that could be sent from their friends abroad or in the very few safe cities left in Sudan. And the situation, we had seen it deteriorate for the past weeks in MSF health structures. We wanted to measure it. Made a mortality and nutrition survey in North Darfur in a camp called Zamzam, a very big displaced camp. And the results are more than alarming. They are already catastrophic. The mortality rates are 3 times the emergency threshold. That is 6 times the normal mortality you should see in that camp. The malnutrition is huge. 40% of women lactating or pregnant are malnourished. For children, it's 25%. 1/4 of children have acute malnutrition, among them 7% severe. Severe malnutrition, that means that those children, if they don't receive food and treatment, will die in the coming weeks. So a catastrophic situation, really.
So what are MSF's key priorities when it comes to taking care of those issues that you mentioned, especially to improve the health conditions of the children in that country and the women you mentioned here that are pregnant, lactating, and others really are suffering because there's no medication, as that's what we hear?
No, you're right. Drugs is very difficult to come by in Sudan. MSF is running projects in 10 states. We're doing hospitals mostly. And of course, we will step up the malnutrition programs in direction of those children that are malnourished. But that's not going to be enough. That's even maybe not going to work at all if there is not a major effort made on food distribution, general food distribution for this vulnerable population, who could be as much as 10 million people in need of food distribution, water, and of course, to allow all this, protection of this population.